There's no particular stage. It actually used to be thought that if you went in a hyperbaric chamber, you would make it grow because cancer likes a large blood supply. But if you look at the blood supply of your healthy tissues, you have your capillaries and arteries coming in and veins going down, they're very neat. When you have a cancer cell, if you look at it, it's all kind of jumbled together. It pulls a lot of blood in, but it actually kills off the blood supply. And cancer is a very anoxic tissue. It doesn't like oxygen. There's a heavy amount of research going into using hyperbarics to help stop the growth of cancer. Most cells need to be deprived of cancer to, I think, about 35% of a healthy cell, and it will turn cancerous. So you can have some protective agencies by using hyperbarics. Using it adjunctively with treatment, there's a lot of research into chemotherapy and hyperbarics. So they will use them in conjunction, and they're finding they need lower doses of chemo and less doses over time. And the hyperbarics is making it more toxic to the cancer because it's opening up that oxygen supply that it doesn't really like. Oxygen being there can help prevent it from turning cancerous. Breast flaps, these are primarily in patients that have had mastectomies. And when you have a mastectomy, they take everything. They take the muscle, they take the breast tissue, they take the little layer of fat that's underneath. And so you're left with just skin. And skin doesn't have its own blood supply. It's very thin and it has a very high failure rate. When they take everything out and before you can do the reconstruction, you're at a very high risk for failure. It's one of the highest flap failures there is. So we're putting all of our patients in the hyperbaric chamber, and we get a lot of other referrals for breast surgeons to do that. And it helps not only heal the skin tissues, but as they start to do fat grafting in the reconstruction, the stem cells in the fat react very positively with the oxygen. You know, dead tissue and another surgery, another reconstruction, it's kind of a long process for them. Radiation is a treatment for cancer. They'll radiate the tissue to kill the cancer cells and kill the surrounding blood supply. And so we'll use it to treat the damage from the radiation, because once you've killed the blood supply, now you have problems healing after the cancer's gone. But there's been research done, and we're actually working on a study right now with a local cancer group that if you do hyperbarics and immediately go to radiation afterwards, because of the vasoconstriction and dilation that happens, opens up the cancer cells to the radiation more, and it helps protect your healthy cells. So maybe you won't get those side effects, and again, they can use a lower dose of radiation.